Hi, my name is Eric Lee, and I will be doing my presentation on cerebral palsy. Cerebral palsy is a group of neurological disorders that affect movement, muscle control, and posture. It happens from brain damage that occurred before birth, during birth, or shortly after. The injury to the brain does not get worse over time, which means CP is non-progressive, even though symptoms can change as a person grows. The full name is just cerebral palsy. It was first described by Dr. William Johns Little in the 1800s. This is a picture of him. And he noticed a link between difficult births and children having trouble walking or controlling their muscles. Back then, it was called Little disease. So what part of the nervous system is affected? It affects very specific areas of the brain that control movement, as you can see here. There are damages to the motor cortex, which makes the muscles stiff and tight. Damage to the basal ganglia, which affects how the body regulates movement. Damages to the cerebellum, which affects balance and coordination. And CP can also involve white matter pathways, which essentially carries movement signals from the brain to the spinal cord. So CP mainly affects the brain motor control system, not the spinal cord or nerves in the rest of the body. So there are 4 types of CP: spastic, dyskinetic, atasic, and mixed. Spastic CP is the most common type, making up around 80 to 90% of all cases. So this is when the muscle in the body are stiff or tight and movements can be jerky or hard to control. And many people with spastic CP have trouble walking because their leg muscles are very tight. And this type comes from damage to the motor cortex. Dyskinetic CP causes involuntary movements that the person cannot control. So this could be twisting, jerking, or slow writhing motion. Muscle tone can switch between being very stiff and being very loose. This type makes it hard to control the hand, arms, feet, and sometimes the face. It is caused by damage to the basal ganglia. Atasic CP affects balance and coordination. Movements may appear shaky or unstable, especially when doing things requiring precision, like riding or buttoning up a shirt. Walking can also be affected. This type comes from damage to the cerebellum. And mixed CP means that the person has symptoms for more than one type. And the most common combination is spastic and dyskinetic. This happens when, as I said, more than one region is affected, so symptoms can vary a lot depending on the individual. So CP can be caused by several different things that damage the brain early on. These include a lack of oxygen during birth, infections like meningitis, meningitis, bleeding in the brain, strokes and newborns, or being born too early. Anything that interferes with early brain development can potentially lead to CP. So when is CP usually diagnosed? Most children are diagnosed between 1 and 2 years old. Doctors usually notice movement delays, unusual muscle tone, or difficulty meeting developmental milestones. And the type of CP is often identified after a brain scan, like a MRI, which confirms where the injury is. So to diagnose CPs, doctors use a combination of tests. A neurological exam checks reflexes, muscle tone, posture, balance, and coordination. An MRI is the most common imaging test and shows detailed pictures of the brain to locate damage. A CT scan may be used if an MRI is not possible. Doctors also develop screening to track crawling, sitting, and walking progress, and movement or gait analysis to identify the specific type of CP. And in some cases, an EEG is used if the child has seizure, and genetic or metabolic testing may be done to rule out other conditions. An EEG is just a test that records the brain's electrical activity. So it is used to diagnose and monitor conditions. So signs of CP depend on the type and severity, but often include stiff or floppy muscles, trouble with coordination, delayed walking or crawling, or speech and swallowing challenges. Some people also have tremors, involuntary movements, or balance problems. Do the symptoms progress? Like I said earlier, the brain injury itself does not get worse, which is why CP is considered non-progressive. But symptoms can change as a person grows. Muscle stiffness can increase, joints may tighten, and some people may develop walking or posture problems over time. So early therapy helps reduce these complications. So the treatment options focuses on improving movement, communication, and independence. So this can include physical therapy, occupational therapy, and speech therapy. Medications sometimes might be used to reduce muscle stiffness, and some people benefit from surgical procedures like tendon release or tendon release. So as of right now, there is no cure for cerebral palsy. Therapies and treatments help manage symptoms, but they don't reverse the brain injury. So some cases, but some cases might be prevented with good prenatal care, preventing infections and reducing the risk of premature birth. So as you can see, cerebral palsy affects about 1 in 345 children in the United States. It is the most common motor disability in childhood. Premature babies and those with low birth weights have a much higher risk of developing CP. And it is most prevalent in African Americans. So as you can see by the chart, about 4 in every 1,000 for African Americans, around 3 in 1,000 for whites, and around 1 in 1,000 for Asians. So most people with CP have a normal or near normal life expectancy. How CP affects daily life depends on the type and severity. Some people are fully independent, while others may need assistive devices like walkers, wheelchairs, braces, or communication tools. CP can also increase the risk of joint pains, arthritis, fatigue, and in some cases, seizures or learning challenges. even with these challenges, many people with CP go to school, work jobs, play sports, and live meaningful, successful lives. Early therapy and strong support systems can make a huge difference. So CP can affect the entire family. There may be increased caregiving responsibilities, more medical appointments, and financial challenges. Families often need long-term support, but with resources and community programs, many families manage well and build strong routines that support their child. So here's a research organization that I found. It's called the Cerebral Palsy Foundation. And they research better ways to diagnose CP earlier, and they study new mobility treatments, therapy techniques, and surgical options. They also work on developing better assistive technology like improved walkers, braces, and communication tools. They have partnered with hospitals, scientists, and therapists around the world to advance CP research. They also provide education and support to families, helping them navigate treatment and care. A picture is worth 1,000 words, and this is my works cited. Thank you.